Iodine 131 is a common radioisotope used in medicine. It is extremely radioactive as it has a half-life of 8 days. Iodine 131 emits two types of radiation, beta and gamma radiation. Beta particles are made up of high-speed electrons that can only travel for a few millimeters and doesn't radiate out of a patient. However, gamma radiation is a very high-frequency type of electromagnetic radiation that can travel for a couple of meters outside a patient's body. One of iodine's 131 main uses in medicine is to treat hypothyroidism. Hypothyroidism is when the thyroid gland becomes overactive and produces an excess amount of thyroid hormones. This can affect the certain processes of our metabolism, such as our growth and the amount of energy we spend. Before the administration of iodine 131 treatment, a patient is required to have done a blood test to check their thyroid levels and to also verify that they are not pregnant, as the unborn baby may be harmed by it. Additionally, it's strongly advised that the patient must discontinue any previous thyroid medication for a certain amount of time before the treatment. The patient is asked not to eat or drink for 2 hours before and after the administration of the treatment, usually in the form of a capsule or as a liquid dose. The treatment kills a part of the cells of the thyroid gland so the remaining thyroid cells can function normally. Depending on the dosage, some patients may need to have the least amount of contact with other people and take necessary precautions as to prevent the people around them from being exposed to the radiation for around 2 to 4 days. The benefits of using iodine 131 as a treatment for hypothyroidism is that there is no need for any invasive surgeries and hospitalization. With the thyroid gland functioning normally again, the patient can lead a normal life. As the dose is quite little, there are no side effects, except that the patient may feel some pain in their throat, similar to the feeling of a sore throat. The problem of using iodine 131 is that if too much of the treatment is given, the thyroid gland may underfunction. On the other hand, if the dosage is not enough, more iodine 131 therapy treatments may be needed. It may also take a few months to know the full effect of the treatment on the patient. The justification for using iodine 131 as a treatment for hypothyroidism is that the benefits outweigh the problems. The doctors specifically calculate the dose of iodine 131 based on the patient's weight and level of overactivity in their thyroid gland. This process is rather common, so the doctors know the necessary precautions to take to make the procedure as safe as possible for each patient.